So the field of mantle cell lymphoma is evolving rapidly. This has been a field of intensive clinical research with 5 new novel therapies approved between the US and Europe, and then they're starting to integrate into the other regimen we have in the frontline setting and modify the field. And the reason why this is important is that we know that R-CHOP alone or BR alone is not sufficient in mantle cell lymphoma. The median PFS with R-CHOP is 14 to 16, 18 months with mantle cell lymphoma, and definitely not sufficient, and then patients become chemo-resistant over time. So based on that, going back over the last 2-3 decades, what has been clearly shown is that the dose-intensive therapy and cytarabine-containing regimen show a much better outcome, both in terms of PFS and overall survival, show the longest PFS in excess of 7 years, and a higher overall survival. This has been confirmed in a real-world setting in multiple observations in the US and Europe. And what is interesting is that the reason why this is better, the cytarabine-containing regimen, is that you have an earlier CR and a deeper response with a higher incidence of molecular CR. So this is really something that has really been well established. The problem that this is those intensive strategies without high-dose tapioca transplant are not necessarily feasible across the board in all patients, given the median age of diagnosis in the mid to late 60s.